Hello everyone, this is Dr. Sharath, consultant interventional cardiologist from Sayadri Narayana Multispecialty Hospital, Shimoga. Today I am going to tell you something about recent updates in hypertension. So, as per WHO, nearly 60% of deaths in India are due to non-communicable diseases, and approximately a quarter of those cases are attributed to cardiovascular diseases, which increases to about 50%, contributes to about 50% of those deaths in the range of in the age group of 40 to 69-year-olds. It's an important risk factor for cardiovascular disease, and to everybody's surprise, it's the most poorly controlled risk factor for cardiovascular disease due to lack of awareness about hypertension, lack of appropriate care through the primary centers, and lack of follow. The prevalence has gone up in the last 30 years from 29% to 38% and 28 to 32% in men and women respectively in the last 3 decades. So the prevalence of hypertension has been increasing, or medication use is also appropriate control of the blood pressure, and medication is also less. About 1 in 5 men and 1 in 4 women worldwide get an appropriate medical management for hypertension. Recently, ISH, International Society of Hypertension, has released the 2020 practice guidelines. It includes optimum and essential treatment paradigms to address the issue of resource-poor settings. So optimum is the evidence-based care, standard of care, and whereas essential is bare minimum standards of care which everyone has to adhere to. In 2021 statement of ACC-AHA, American Heart Association, they classified stage 1 hypertension based on the ASCVD risk of the individuals. If the ASCVD risk is less than 10% with stage 1 hypertension, they can go for a non-pharmacological management of the hypertension. If it is more than 10%, you can go for a pharmacological management of the hypertension. So it's important to know the global risk of every individual of having a ASCVD, and based on that, the stage 1 hypertension, that is 130 to 139 systolic and 80 to 89 diastolic, can be managed accordingly. ARDS, what about COVID-induced ARDS? Any benefit of beta blocker, metoprolol? Metoprolol has shown a improved lung function and decreased lung injury in patients with COVID-19 induced ARDS. What is the new standards of new targets for blood pressure control in the recent times? So the trial which showed increased benefits with lower blood pressure was the SPRINT. Now we have another trial, STEP trial. It affirmed the lower targets for control of blood pressure in India. So it's derived from a Chinese population of 60 to 80-year-olds. So it affirms the SPRINT observations found out in the SPRINT study. So, but still the guidelines say, most of the guidelines still say that the target should be around 130 to 150 based on the age and comorbidities. Ambulatory blood pressure monitoring is definitely recommended. Rather, ESC 2018 guidelines recommend this ABPM, or at least home-based BP monitoring, for the diagnosis and to identify the burden of the hypertension in individuals. So just office BP is not enough to cause the real burden of hypertension, and especially nighttime and average 24-hour BP are more important, and they are closely linked to mortality and composite of CV outcomes. It is observed that for every 10 millimeter increase of BP measured at night, the risk of mortality increased by 23% and risk of cardiovascular disease went up by 36%. Most of the patients with hypertension require lifelong medical treatment to achieve the optimum BP control. The 2018 ESC European guidelines equally recommended 5 classes of drugs for treatment. They stressed upon going for a combination therapy as adherence and a response to therapy improved with combination therapy. So either we can combine an ACE inhibitor or ARB with a CCB or a diuretic. So combination treatment or FDCs are recommended. Combinations are recommended for the initial treatment, even in the initial treatment of hypertension. Problem with valsartan was since early July 2018, products containing valsartan have been withdrawn or recalled worldwide because of the contamination with NDMA. NDMA has been classified as a carcinogen substance for humans, and all valsartans have been withdrawn because of this NDMA. Then the HYGEA study. This is the largest study that tested the nighttime antihypertensive treatment. The nighttime treatment, as compared to early morning initiation of the blood pressure medication, resulted in improved survival, improved decreased incidence of cardiovascular outcomes, or favorable, exerts a favorable CV risk reduction. I think that's all for the day. Thank you very much for patient listening.